Greetings, Earthlings. How are you, everyone? And welcome back to my new episode on COVID-19. Today is March 9th, and I'm going to talk about 1 million test kits. Okay, you ask me, what about it? Allow me to explain. So supposedly we're having 1 million test kits being passed out to test centers all around the country. And that's going to be, we're going to find out who actually carried the virus. Anyway, that sounds like a good news, but in the past episodes I said 1 million is not enough. We have 350 million people. And obviously there's some feedback saying that, hey, we don't need to test everybody. Not everybody has it, right? That's true. Hopefully we don't, if everybody caught it, then there's no point testing, right? So everybody already has it. I think above certain threshold, testing becomes, basically futile. When the Black Plague was in play in Europe, that was a bad time. And of course, they didn't have testing, but basically people were not looking at how many people died in the village. They're just like, oh, how many are left? And then they basically do the subtraction. Okay, so 1 million, is that a big number? Well, President Trump thinks it is, but let's find out. I just came across this video, very useful one. It's from 3 Blue 1 Brown. I don't even know what that means, but it's a really good math channel, and it teaches a lot of good math problems. And if you're not turned on by math like Andrew Yang is, you don't have to worry about it, but I love it. So I'm a subscriber, but subscribe. So it just happens that it tells about exponential growth and epidemics. So it talks about the COVID-19 cases. Actually, it's outside of mainland China, so it's somewhat reliable. And it's found out that it's plotted all these data, and it follows a trend. And this trend is called exponential growth. So what it is basically that you have one person passing it to another person. So now 2 of them are contagious, and they're going to pass to 4 people, and then after a few days they're going to pass to 8 people, and then they're going to pass to 16 people. That's a simple concept behind it. And in nature, we find that the growth in numbers tend to follow this way. That's why it's called exponential growth. And okay, so that's the basic idea about it. And if you follow this graph, it goes actually an explosional graph. So let me just play a little bit, and then I think let me turn down the volume. And you can see that it will grow if you zoom out, if you follow this. So basically it's multiplying by a certain number around a certain number. So he's going to model it, and then he's going to explain everything. Well, go watch it yourself. It's a good video. And then he's tracing this plot, and then he's found many ways to actually... Anyway, it goes a lot more deeper into this. So basically, it tells you how much it bends. And then he found that the rate, this base number, is very important. Right? So if the base number is 1.15, as it is appear to be right now, well, this track, and after 61 days, you get this number. And then if it's 1.05, after 61 days, you get another much smaller number. Okay, let me see if it's a little bit more from here. Actually, it just jumps over. Anyway, so it's 1.15. So I did a graph myself. So that's how many I put it here, 1.15. I added 100,000 as a base unit, or it doesn't really make sense right here. So 20 would mean 20 million. 100 would actually mean 10. I'm sorry, 20 means 2 million. 100 means 100. Actually 10 million people infected. So this is 1.15. And as you can see, we can start at a very small number, at 0. And then if we do that every day on this red curve, after about, let's say, 40, 50 days, the growth is just crazy. And I also plot on this green line. Basically, this is 2 times 100,000, right? Because it's 100,000. After how many days? T is the number of days. So what is that? You ask me. 200,000. What is 200,000? So if we can produce 1 million testing kits every week, that means it's roughly 200,000 per day. We have weekends, right? So let's say we don't stop producing 200,000. And what we do is that I plot the green line. So as you can see that, this is however many testing kits we're going to accumulate. And the red line is how many patients we're going to have. So at this current capacity, we are going to be overtaken in about 50 days. Okay? And then in 50 days, sometimes, some patients need, well, I think each patient would need more than one, right? And then we're going to test a lot of people to find out one person. Like, let's say, if we test 5 people and then we find one person infected, and then that person would need to give in more tests. So actually, it actually turns this number lower. So in actuality, it should be about 0.5. So if you can look at it that way, that's assuming that we have the capacity to administer 200,000 tests every day. We're going to be overtaken around just under 40 days. Okay? So we have a little bit over a month to get a test administered and get a full handle of the situation before things get out of control. That's the way it is. And then I plot it again, say, what if it's 1.05? Okay? And then I plotted this blue line. That's the same thing. Let's reduce that to 0.5t. What we have is we have over 150 days for the intersection to happen. Okay? Same way, start with a very low number, 150 days. So that's about 5 months time. So in 5 months time, if we don't do anything, actually if we do something to reduce it, we'll have 5 month period to allow our testing to cover as many patients as we have. So by that time, hopefully we can discover most of them, and then this curve will not grow. We'll see something as what he would describe toward the end as a logistic curve, where things level out at a certain point. That's what we want, okay? That's what we want. We want to give ourselves this buffer zone right here and achieve this 1.05 growth rate, growth base, okay? This is a base number. That's the exponent. That's an exponential growth. So that's what we're hoping for, okay? Everything we do should be geared toward turning this number down, lower. So that will buy us more time. The more time we have, the more testing we have, the more experience our testing can get, the less stress we put on our medical system, the better hope everybody has, okay? So what does that mean? What does that mean for you? Because today we just experienced like a stock market crash, the worst since 2008 crash. So, well, keep watching. I have another video for that, just to talk about the financial implications. I'm going to draw back to this reference here. So if we can, keep in mind, if we can achieve this very logic curve, then we can control the virus, control the spread, and then we can have a certain, we can accept a certain population. And then have our medical staff handling them, quarantine the ones that are questionable, quarantine the ones that are really transmitting to others, and really get a control of the growth of the virus. That's what we want to achieve. At this time, we don't see any way to actually completely stop the virus. Hopefully, the warmer weather will help. So if we only do 40 days from now is mid-May. But it might still not be too warm in certain parts of the country. But if we can elongate that deep into fall, then we can get a handle on this, and then we can hopefully prepare for winter, okay? So that's all I'm saying. So how do we do that? Before we get into the financial part, how do we slow down the space number from 1.15 that's being measured to 1.05? Basically, we need to do social distancing. And the more social distancing we do, the better off we are, okay? So we're not going to stop the virus, but if we can slow down it enough, we can gain enough head start on the testing and quarantine, and we should be okay. But if we just allow things to go as it is, it's going to spread really fast. So we need to practice social distancing. We need to wash our hands. We need to put on our masks. I know there are not enough masks, but we need to, tones of the government has been changing. They're suggesting that older people or people having certain problems, they need to start practicing social distancing and start wearing masks. And then right now, today, I went to Costco, and people started wiping things down, the workers trying to disinfect things. And those are good. And then I see a lot of people, especially elderly, they started wearing masks, which is also good. Because as much as the government says masks don't work, why do you think the doctors and nurses need them? Because they work. It's just that people don't wear them properly. But that can be solved. We can teach people. We can have good information to teach people how to wear masks. That's, and then they can protect themselves. In China, they have They have a huge number. They have a huge growth. They don't have experience. They didn't have any good information. They're just feeling their way around this virus, and they are having the control over it by doing what? By doing all these things. By doing social distancing. By wearing masks. By just really managing themselves and not producing things, not rushing back to work, and just follow good common sense. They're just doing that. That's the only thing that's working. Outside of China, it's still growing exponentially. Now, today, Italy is following suit of China. They shut down the whole country. No more traveling. Only essential functions. No more ball games. No more social gathering. Because why? Because that's the only way that works right now. That's the only thing that really works. I know. So washing hands, keeping your distance, those things work, but they only slow down. They may bring it to 1.14, 1.13, but we really want to bring it down to 1.0 something, 1.06, 1.05. That's going to make a huge difference. I know these numbers look abstract, but we have to try, basically, okay? So basically, the exercise you can do is you can try to find today's number, jot it down, say in the USA, where did it go? 607, right? And then tomorrow at the same time you come back and then take the next number, write it down, and do the division. That's how we find this number. If 0.05 is 33, so if we are about 640, we're doing a good job by tomorrow. If 0.15, we're looking at almost 700 tomorrow, then we're still on this 1.15 track, okay? And okay, here's another math for you. Roughly each dollar we spend, or each each packet of energy and effort we spend today, we're saving 8 times as much work later on. 8 times. That's on rough measures. 8 times. Think about that. So if we spend $1 properly today, if we do one thing properly today, that's going to save us 8 times of the trouble down the line. Think about that. So the earlier we start doing something collectively, shut down the schools, shut down everything, and then get the testing kits out there, and then let people start testing everybody who is questionable, who has any sort of symptom, then the better off we are. I don't want to spread panic, but I'm just telling you that there is a way to defeat this. We don't have to go into really heavy social shutdown like Italy is experiencing now, because they're in panic, they're in fear. We don't need to go to that step. But we're only like a week, less than a week behind Italy, okay? If we allow this thing to go on for a week, just as it is, we're going to see Washington State shut down, California shut down, or something like that. New York City, Manhattan shut down, something like that. It's going to be chaotic. I know, the presidents, the politicians, they want to pass on information to tranquilize the society, to put people at ease. But only thing that can put people at ease is that we're doing the prudent measures, and we're preventing this disease from spreading and consuming our economy. Okay, I'll talk about that in the next video, because I've gone on for too long right here. This is the age of social media information. Okay, we need to get quality information to go. So the only thing that can outgrow the virus spread is information propagation. It sounds bad, but it sounds like propaganda. But the propagation of information is light speed. We can do that. So pass my messages on. Go to the recommended videos and watch them and try to learn something. And arm yourself with knowledge. Then we're not falling into a panic. Okay? All right. Okay, so that's it. I'll see you very soon, because I'm making another one right now.